In today's Health Watch, we are talking about the flu. Cases are peaking for a second time this season. At least 41 states reporting high or very high levels, and ER visits for the virus have shot up nearly 30% compared to the week before. A surge in flu cases has even led to temporary school closures across the country, including in Texas and in Tennessee. Dr. Rabia De Latour is a gastroenterologist at NYU Langone Health, and she joins us now with more on how you can keep your family safe. Doctor, thank you very much for being here.
Thank you for having me.
Why do we think the cases are going up, and this is a second peak we hear?
So these numbers, while staggering, we have over 20 million cases, 250,000 hospitalizations, and unfortunately over 11,000 deaths, including 47 pediatric deaths. These cases are staggering, but they're not unlike numbers we saw pre-pandemic. Okay. We got a little bit spoiled after the pandemic because of precautions that people were taking to prevent the spread of coronavirus. We also saw decreased numbers in flu, RSV, the common cold. And what that resulted in is a little bit of an immunity gap, where society as a whole is less immune. We have slightly lower vaccination rates, and so our defenses are slightly down. But then here's the virus, the same virus. It's not any more virulent, similar strains. It's back, knocking on our doors, but we have slightly lower defenses, and so we're seeing a rise in cases.
Is it too late for somebody to get vaccinated? A lot of people do it before the fall or in that time, but people that haven't, can you still get vaccinated for the flu and have it have an impact?
The rule of thumb for flu vaccination is as long as that virus is circulating, you can absolutely get vaccinated. And so we encourage anybody who's eligible to get vaccinated to do so.
If you have the flu, what are the treatments?
Well, there's no actual definitive treatment. There is an antiviral medication, well known, called Tamiflu, and that has been found to reduce the duration of symptoms. We don't recommend it for everyone. You're technically eligible if you're aged 2 weeks and older, but we tend to recommend it for people who are high risk, immunocompromised, very young children, pregnant women, people who have severe comorbidities like heart disease or diabetes, and you're at risk for getting pneumonia or getting sicker from the flu. Those are the people we tend to recommend Tamiflu for.
And they have at-home flu tests now, but is there any reason you need to have that to know? Is it going to help you?
So at-home flu tests are somewhat new. These are combination COVID and also flu tests. I think the biggest utility of these is to help you kind of define what you have so that you can prevent the spread. I think people are going to be a lot more willing to stay at home and isolate themselves if they have a diagnosis of the flu to prevent it from getting to people who are immunocompromised in society or at school and whatnot. So it helps you with information, and information is power.
Right.
All right. Dr. Rabia De Latour, NYU Langone Health, thank you very much. Appreciate it.
Thank you for having me.